welcome to
What They Don't Tell You podcast.
the pre-dental edition.
So today we're going to talk about the difference between dental assisting versus dental volunteering versus dental shadowing.
What is the difference?
I mean, logistically, not much, but when you are filling up the ADSAS application under the experiences section, there will be a drag down menu where you have to specify what kind of dental experience it is. And actually, employment also goes underneath that. So, for example, dental assisting would count as employment as opposed to just a dental experience.
Oh, so you can't mix, I wouldn't be able to mix my shadowing hours with my dental assisting hours.
Right. They are two separate categories, like on the application, and you shouldn't want to anyway, because I think the more stuff you have on your application, the bulkier it gets, and it makes it sound like you did way more.
I did volunteering, I did shadowing, and I did assisting. So what would you describe, besides pay, right? What would you describe assisting versus shadowing as? Like, what would be the main difference? I think, firsthand, payment, like being an actual employee who gets paid,
Right.
versus someone who comes in and shadow. Like, what are the responsibilities? What's the difference?
Right, because I'm pretty sure as a shadower, you aren't allowed to do obviously any kind of assistant duties unless it's like sterilization or like that's like office by office, depending what you're allowed to do. But I think you're right. I think payment's like the main one. So if it's like written somewhere that you are getting paid for it, it no longer counts as shadowing hours.
Okay, and then volunteering has its own.
Yeah, that's its own like scope, right?
What was your experience between volunteering, shadowing, and assisting? Like, what was your experience?
I had all of them, and I actually even had dental interning. So that was another one.
Like dental interning.
I was an intern, at a dental school, actually.
Oh, cool. What dental school?
My undergrad, which happens to be the one where I'm going back for dental school.
Full circle moment.
It is. So yeah, I also has that as a dental intern there, or listed that. And that counts as enrichment, like dental enrichment.
Okay. There's places that I went to shadow, and then there's places that I went to assist for a job. But even when I went to shadow, I got a lot of hands-on experience.
Right, but nothing like chair side, right? No, I think that's allowed. It's not like it's not, but I think it's based. I know.
Jail.
No, I think it's just based on the offices, like the dentist distraction.
Because I think I shadowed after being certified as an assistant.
Okay.
So, like, even though I was only shadowing, I was still certified to assist.
Right.
So that gave me an upper hand, I think, and when it came to shadowing. I think that's also why I didn't really understand the difference, because it felt the same, I guess. In the application process, you do separate it. So let's say, for me, I did dental assisting and I also did front desk. Would that be separate in the application also?
Right.
Okay. So if you had different roles in an office, like I did, you can separate that in the application, and also makes it bulkier and looks good. Because you can. Oh, is there a part in the application where you write like paragraphs about all your responsibilities, or is it in a form like a resume form?
No, it would be, so every section that you do add under experience, you would have to put like the title, your role, which would be either volunteer, employed, whatever it may be, and then there's a whole like paragraph you can write about duties. So recently we did a volunteering experience together in the dental realm.
Yeah, it was so much fun. We had like mobile vans. It was sponsored by Crest, and it was called Closing America's Smile Gap, and it was amazing.
That would be considered dental volunteering, because even though we did do pro fees and like exams for patients, and they were in mobile vans, which is kind of clinical.
Doing like, everybody had a different position, so like what you do while you're volunteering also can look different. Because I did one with Feeding South Florida, which was we made boxes for the elderly, and with packaged food and stuff like that. And I thought, so that's different, because it's not dental related, but it's still giving back.
Right. And I've worked for mobile caravans before with the Ronald McDonald House back years ago. But even that, I was told that could be two separate experiences, because I started off just shadowing and then became kind of volunteering on a weekly basis. So again, do that if you can. Like if you can, if you have different roles in a specific
office or
office, experience, company, whatever it may be, like split them up because that will help you. And it's not repetitive at all. Because that's what I thought. I was like, oh, I'm not going to repeat it twice. It looks like I'm trying too hard. Several admission committees told me, like, no, like, please, like, you should deserve the credit for that because you did put in so much work and have different roles.
Yeah, because I remember I shadowed at 2 offices at the same time. And that's how shadowing, eventually I was offered positions.
Right.
In the office. So shadowing was literally my way in.
Right.
To being employed. So I didn't know. See, I didn't even think about that. Like, you can put the time that you shadowed and then in a different section put the time that you actually were an employee there.
Right. Yeah, and I think same for me when I was doing my shadowing. I did it in a hospital, actually. So there was like rotating like 5 different dentists that were there, and I wrote that as 5 different experiences because it's 5 different dentists, and you know, there's that paragraph to explain like, oh, what kind of, maybe one doctor did different procedures versus a different one.
There's also like specialties too.
Exactly. Every single one. You want to split it up.
Right. I've never worked in a hospital environment. I always work at private or shadowed at private practices. What's the difference? Like, what do you think the difference is with private practices and hospitals?
The hospital is chaotic. It was absolute chaos at all the time. And that's when I knew I was never going to be like pre-med because it was, you know, it was trauma to the face.
Yeah.
There were some regular scheduled, like, you know, Medicaid, Medicare patients that went there, but you would also have a lot of emergencies. So for example, one of my dentists was specific emergency only chair. So that paragraph I wrote down, you know, this is specific to like last minute, because it teaches you, you know, fast-paced environment.
Yeah, okay. I worked in an environment similar to that, but it was more of a Medicaid office, and it was chaotic, and like how much patients were coming in and out, and like how busy it was. But there were different doctors that saw patients. Oh, I don't even look at me figuring stuff out. Going back to what you said, I never worked in a hospital because I don't like hospital environment.
Yeah, the environment is too much for me.
I just don't like it. I just be too emotionally invested.
I think similar. There was no resolution, right? Like, he would come in for an emergency, a patient would, and we'd like fix whatever needs to be done. But then like there would be no follow up because then he goes back to his regular dentist, and I was like, oh, what happened to him? Is he
like,
okay?
I want to know, like, what's his number? Like, I need to check on them. And,
right.
Yeah.
So you never kind of see the same patient again, like twice, and I did not enjoy that.
Okay, I couldn't picture it. Like, the office I worked at, I love my patients. I speak to them still.
Me too.
We follow each other on Instagram or when I go back to the office to shadow. Now that I'm not assisting as an employee, I still go back and shadow whenever I'm home. And when I go see the patients and they're like, oh my God, how's school? And I'm like, how are your teeth coming along? Like, it's such a great relationship, and I prefer that over like transactional kind of that feeling.
Or even like you said, just like regular shadowing. I've heard so many like sad stories from my friends who had shadowers where like they weren't really allowed to ask questions. They just kind of sit in the room and like watch.
I've been in that too.
Right, and I don't like that.
I shadowed at an ortho office, and she was amazing. It was really like quiet, and I'm like bursting out my seams because I just want to ask. I'm so curious and I'm so interested in what I'm doing, and she's just like, don't like
require silence to work, maybe.
Probably. So you have to respect that too. I'm working on it. Don't take everything personal. Sometimes different doctors have different ways. Like, I know one of my dentists, he would play Frank Sinatra to get started, and then like, I like Frank Sinatra music, so I was fine with it, but I'm pretty sure like a 12-year-old is probably like, I don't want to go there. It could come off as scary, but everybody has their way. So you also have to understand that when you're going in for dental assisting or shadowing, like, every doctor is going to be different, even if you're in the same office. So learning that, I think those were things too that I learned shadowing or assisting or whatever the case may be.
I think also, though, don't be afraid to maybe ask. Like, maybe they don't know that you have enough knowledge to ask, or maybe, you know, sometimes they think you're just getting your hours in, but maybe, like, start asking first and see the reaction first.
Yeah.
Because I remember I would ask a lot of questions, and I think some would get, like, a little annoyed, but...
I'll take pictures of their setup, and I'll just look it up. Like,
later.
I'll just go do my own research later, if that's the case.
Like, make the most of your experience, even if it's good or bad, or, like, silent or not. Make the best of it.
Yeah.
I think the whole point of shadowing, right? This is why it's a requirement to see, like, can you see yourself there doing this?
like in one of my classes, I was talking to some students that are D1, and they're like, I have no idea what happens in a dental office.
I'm not gonna say anything.
And I was
That's
like,
crazy.
hey, you got in? Okay.
That's crazy.
I was like, I was like, okay. All right, I have a chance. That's all I got from that. I was like, you know what? That's okay. I did the research. I put in my hours. I got the time.
Like, don't be like him. I think that's the moral of the story. Like, you should know exactly what you're getting into. That's the whole point of shadowing.
I think it fires us up because we've been going at this for so long and
Yeah.
we've been in the environment for so long. So I get a little triggered.
Dental schools were more focused on, like, you know, the perfect grades
Yeah.
and things, and now they are looking for that person who's, you know, had life experiences, people like us, non-traditional, who've worked in the field, so they know, like, we know exactly what we're getting ourselves into.
You could be great, you know, academically and then lack the personable part, which I feel like it's probably 80% of the field.
Yeah, unfortunately. But
So I'm glad now that, and on the flip side of that, I am glad now that schools are recognizing that and they're making effort to get to know the student.
there's another side topic I want to talk about is dental enrichment. So these are the
Okay.
things you can also list on your application under the experiences section. And that is going to be things that you've done that relate to dentistry, but maybe like aren't specifically volunteering or assisting or shadowing. And I think a good example is what you're doing right now, that Harvard, what is it called?
It's a pre-dental bridge program that goes through DAT prep, the dental school application. It just helps you, and you're talking to students that are already in the school. So the students in the first class, they were all D1 and D2. The other two, they were foreign students that came from other countries, and they were starting out or towards the end of dental school. So that's cool. I didn't know that I can add that.
Yeah, definitely add that because you're putting
So
your
that's right.
hours in every week, right? Attending this like
Yeah.
seminar, this lecture, and that's on your free time. Like, you're not required to do this.
Yep.
So it makes you look proactive. And I know for me, I listed all of my SNDA impression days. So if you don't know, as a pre-dent, a lot of these dental schools will offer days where you can come in for like 9 to 5 on a Saturday, and they'll like show you all around the school, and they'll give you like the DAT tips, interview tips. They'll let you usually do an impressions of like your mouth, which is really fun, like Allergenet. But I did that for 3 different dental schools in like, cause I live in a big city, and I did that for 3 consecutive years.
Oh,
So
nice.
I was able to put that and it's like the hours as well as the dates and put at that it was annual. So definitely list things like that as well. It still counts as dental experience.
I actually want to attend one because I've never been to one.
They're so helpful because, you know, you get to see the school as well. You get to see the class culture, how the classmates interact with each other. You meet the admissions and things like that. So definitely look
Okay.
up the schools that you really want to go to on your list and look up pre-dental dates.
Okay, so that will go in the enrichment part of the. So would that be under volunteering?
So no, that would be a
Shadowing?
separate
Oh,
category.
completely.
So there's another like a drop down, and it's academic enrichment.
Oh,
So that's what it'd
So it's
be.
enrichment and then it's academic enrichment.
I think it's together. Like
Okay.
there's like one that just says academic enrichment, and that's what it would fall under.
Confused. Okay.
There's just gonna be like every experience you list. There's gonna be a little scroll down,
A
right?
little
So it's
scroll
gonna
down.
one of them is academic enrichment. There's like extracurricular. There's employment.
Oh, got
there's
it.
volunteer. And there's dental experience.
Like it just shows. It's pretty much just showing everything you. This is like a job application. I
Yeah.
don't want to keep saying that, but that's what it's. That's how I can make sense of it.
Yeah.
So like making sure your resume has everything you've ever done in order to connect with what you're about to go do.
Exactly. But also I think it's important to know, also list the things that don't relate to dentistry at all. Because they want the well-rounded student as well. And I was just talking to my friend about this because she's applying this cycle as well. And she's like, oh, I didn't put that. And I was like, why would you not put that? You were in this certain club
Yeah.
for like 2 years. She's like, oh yeah, it has nothing to do with dentistry. I was like, no, you put that. That's your time. That's your commitment.
So I can put that I started a business.
Yes, absolutely.
Like, you guys care about that? I started a business.
See, so that would be employment because
nice.
that's right.
Okay.
So put the things that even aren't dental related at all. Things like dance teams, things like art
Oh, I did
programs.
dance.
You would put that.
I'm like, I'm remembering who I am while I'm sitting here. Like, oh wait, I did dance. I tap danced for a while.
Right. So, well, it depends. There's a time frame. Anything I think after high school or college and above counts.
Yeah.
So don't do anything high school unless it's like you've received an award or trophy or like a certificate.
Okay.
I believe that's the standard.
I got perfect attendance.
Yeah, I wouldn't put that to be a pleasure to have in class. Yeah, I'd skip that.
Okay.
But for me, for example, I did an academic enrichment program in high school for 2 summers. So even though it's like high school, that's important. I put that on my application.
Okay. So let's say, because I have a little bit of issue with volunteering. So I volunteered independently, I guess you would say. So, for example, my parents travel a lot from New York to Dominican Republic, and we would make these big boxes and we would donate at orphanages in Dominican Republic. But I didn't work with any corporations or any outreach programs. How would you put that in the...
Right.
How would I add that? Because we literally did it every season. So like from spring to summer and from fall to winter, we would do these packages and go give back. So what would you...
You definitely have to log it, and it does ask you for some sort of title, so I think you could just kind of make it up. Or like say, like, you know, servicing the DR or whatever it needs to be. Yeah. And then because you have a spot to explain it. So like that's where I would put the bulk information, like what you did, put your hours, dates. That's unique too. See, that's a very unique experience, and I bet if you write that, they would probably ask you about that during your interview.
Yeah. I get it from my mama. We always give back. When I see schools that focus on that, I'm like, it really aligns with just how I was raised in general.
I love that. Aw. So what other like dental volunteer opportunities have you done?
Dental, see here it is, like dental volunteering.
Volunteer. So can you think of a certain like, even if it's like a 1-day thing, like things that are not considered as assisting and not considered as shadowing?
But in the dental field. I don't know.
Just to give more examples.
Does it count that my mom's friends all come to my room? Like, I have a toothache and I'm like... Oh,
personal consults?
Yeah, they're like coming to my room and they're like, hey, I have a tooth that fell out. And I'm like, girl, go to the dentist. Like,
not there yet.
There's nothing I can do yet. Aww. Even if I did, I feel like, why... Like, I'm supposed to pull out a whole like chart and tray. Dang, that's in dental. That's not assisting or shadowing.
So I'll give you an example, which I'm thinking of that I did. I volunteered with this place called Rosie's Place in Boston. And we would go with BU dental students and give free checkups to these women in these shelters. See how it's a dental experience, but it's not really shadowing because I was like signing the patients in. I was giving them goodie bags and I would write down their little charts.
I would have to really sit and think.
Right.
And think about something like that.
But I recommend that. Like, definitely just sit down and, like, even the things you thought were, like, little or didn't really mean much, like, that could be an experience you put on your application.
That's what I'm starting to realize now. I'm like, I've done a lot of things. Not all necessarily have to do with dentistry. Right. But, like, bartending helped me be more social and talk to people more and just listen to people more, too. Because I think you're kind of a therapist when you're a bartender. And I think it brought me out of my shell. So... There's a lot of things that I've done that I always felt like, at the time I felt like it was a waste of my time. But now I'm like, okay, what did I gain from that experience?
Exactly. You just have to like spin it to make it positive. Because I know for me also, just like working throughout the years, right? I did so many different like retail jobs and like...
Retail is so fun.
So you learn so much, right? Like customer service skills and like interaction, financial... whatever it may be. So, like, make it sound better than it was. You know, don't feel like I folded shirts all day. Like, you know.
Like, there's systems, there's inventory. Like, I learned that. Like, teamwork. Working retail, teamwork.
Having, like, a visual eye, right? Dentistry is partially, like, art. Like, you want to show, like, oh, yeah, like, I did do that. And I could tell when things look better this way versus not.
Like, I have an eye for aesthetics. Dental shadowing versus assisting versus volunteering.
So do you guys know the difference now? Comment below.
Let us know.
Yeah, I feel like it's gonna be a fun game too. Like, can
Yeah.
can each person like write down like one of each that they've done
Oh,
personally?
yeah.
Like, what's the difference? Be sure to like, subscribe, and comment below.
Hit the bell notification so that you know every time that we post, and follow us on Instagram and TikTok. You can DM us there and share some of your stories. We are excited to hear all about it.
Yes, and like we said, we do have a whole completely separate video on our dental assisting experience, so be sure to check that out as well.
Yep. Bye.
Bye.